Good morning. I'm taking Southern Shoshone, so I'm practicing. I'm going to introduce myself because it's what I'm supposed to be doing, taught to do. So, Danjay, ING Media Uye, Luan Man Kai Iche, Asua, or Ama Gudia, Asua Tutlasen, Ata Ken Wilson, Asia Fred Chambers, Uye Na, he's passed. And my name is Medea Alatini. I am Kajut, or from the Crow clan. I am from Kluane First Nation. And my mother's name is Indunke Gudia. In English, it's Mary Jane Johnson. And my father's name is Ken Wilson. He is a gold miner here in Dawson City. My grandmother is Lena, or Indunke Tutlasen, and my grandfather is Fred Chambers, and he's passed. Why am I here? So, because Michelle asked me, first off. I wanted to kind of describe a little bit about my background or my experience, and I'm going to switch to the rotating or the roving mic here. Thank you. Because I am not wearing high heels today, and I'm hiding behind the podium. So just a little bit about my background before I jump into what I'm going to cover today. I don't have a PowerPoint presentation because I tend to jump all over the place, and PowerPoint doesn't, it's not conducive to that. So I have been fortunate to have been raised on the land. My mom's a hippie, goes way back, and really was an advocate for wanting to preserve language, culture, and ways of being. So I grew up in the bush, on the shores of Kluane Lake, lived in a teepee in Riverdale, have had a lot of travels, hitchhiked a lot of places, and also fortunate enough to be an attendee at the Kluane Lake School, so Kaitse Danku. Our parents didn't want us to experience the racism that they had experienced going to school in Destruction Bay, at a school that was predominantly non-Native and didn't have any Native context. So we have some very powerful matriarchs in our community, and that school has produced a number of really strong matriarchs in our, or matriarchs in waiting, I guess, in training for our community. And when I say that, most of the graduates of that Kaitse Danku school have gone on to either post-secondary, at a minimum of a bachelor's degree, and some have gone on to get their masters and PhDs and have amazing careers and have really instilled that in their children, our children. So there's something to be said for this kind of this drive from our community to be self-sufficient, self-reliant, and to really lead the way. So we've done that in a lot of different initiatives. That led me to live in Victoria. I got my degree from the University of Victoria in commerce because my dream at the time was to be the band manager. And then I skipped that and became chief. So I thought, very practical, what is a good career, what could I go to school for, and really be of service to my community. And of course, business it just made sense. So my sister, when she went to university for music. And I was like, oh my God, are you serious? Music? What are you gonna do with that? But as I grow up and I'm in these leadership roles, it really becomes apparent that speaking and fanning the flame, really getting people to grow from a place of strength. Diette's musical, and that's her path. And going for a bachelor's degree in music and studying opera it's amazing. Like the background that she has, and she's infused that and brought that back to the community in terms of language, in terms of my daughter now thinks that she's a rock star, and she pretty much is. And she's so talented, but it's because my sister is strong enough to realize that she has a gift and she can follow that. So there's this environment that I grew up in, and that has been a nurturing kind of microcosm for our community. So when we think of, okay, we can do it, I have no qualms of saying, I have a dream about doing something and it's going to happen. So there's, and I remember as a kid having the saying of, whatever boys can do, girls can do better. So, and with that attitude, and I really believe that coming from a matriarch society, we really need matriarch energy in our governance, in all of our systems. And when you look at health and education, it is predominantly frontline women. Female energy is there. So how do we permeate that outside of frontline into the policies, into the decision-making, into the legislation, and into the formation of the infrastructure that supports health? So what I'm going to talk about is throughout the, I guess, past, whatever, my working career has been very broad. I did business, I have worked in nonprofits, I've worked in tourism. Infrastructure development has always been a background of mine. I love building houses and seeing infrastructure developed, and that's what I worked at in Vancouver. Moved back, I've been the capital projects manager for our community. So in those types of roles, I'm looking at the big picture of community development. How does the community infrastructure really thrive? How do you build a thriving community? So you need electrification, you need good roads, you need good water, you need to have a sewer system that functions, you need to have houses that are safe and that are warm in the winter, that don't have a lot of heat loss. And how do you position your houses so that you're creating community? What kind of community facilities do you need? What kind of education infrastructure do you need? So all of those things go into thinking about infrastructure development. So take that into the role of chief, where we were able to build up a lot of really amazing things for our First Nation. So I was chief and served on 2 councils. And when I say chief, it's chief and councils. It's a team. There's definitely a team of people that are leading these initiatives in our communities. And I was fortunate enough to serve as chief from 2010 to 2016 over 2 terms. And during that time, we were faced with mining. There was that big mining influx in 2010, 2011. Largest staking claims in history, larger than the gold rush. So there was a lot of activity in our territory, and we had to really think about what kind of behaviors do we want of the miners and the stakers and all the other proponents that are coming into our territory. So we had a mining summit and talked about mining legislation, and we created a guideline for how we wanted people to come into our community. That strategy we also used outside of mining. We also used it for education. We used it to establish the fact that we wanted to have Kitsidanku back. And right now we're I'm like, it's almost at construction. I'm like, please. Tosh is on that working group, right? Different workshop. Okay. So we took that kind of methodology of bringing in experts from around the world and Canada and the Yukon and saying, okay, what are some of the best practices? What can we do here? So we did that for mining, we did that for education, we did it for energy, and taking those kind of lessons learned, that approach that is kind of, I feel like it's a pragmatic approach. I was like, okay, it must be that business background going, okay, where's the best practice? What's the case study out there? How can we integrate that into our work here? So taking that and then that experience, that background, and bringing it into the work of the pandemic has been crazy. So of course, during the pandemic, and I have to say first, before I jump into that after serving as chief, I did some time Freudian slip. I had the opportunity of working in the cabinet office, and I worked with Minister Frost, and I have to say that woman is a champion. She held more portfolios than any human is capable of, and she did an amazing job, like pulling together the fact that we got putting people first out of a government in this time span that we did is incredible. And just witnessing her work ethic and the amount of pulling strings together that she does, it is astounding. And I think we really have to hold her up for the work that she's done. Because that vision for putting people first and getting that out into the world and sharing it as a vision for our territory it's game changing. And I think I'm going to tie that in. So after that stint at the cabinet office, I decided that sitting in a box is not for me. I like being my own boss, and I like being able to incubate ideas and be able to work in many different realms. So I started my own business, and it's called GSD Strategies. I am the chief strategist, so I started that back in 2017, 2018, and GSD Strategies stands for, depends on the environment. It could be good, solid decisions. It could be, or what I'm known for is getting shit done. So it's get shit done strategies. And there's a funny, so my friend who's a life coach, she goes, Medea, do you really want to attract shit? Like, is that something you want to work in? I'm like, what do you mean? She goes, well, you put it in your name, it's going to come to you. So guess what? We're working in wastewater monitoring. Like, what the heck? So what I want to talk about today is really just all of the things that I get to work on as GSD strategies. And I think it's great. It actually gives me a good bird's eye view, 30,000-foot view of all of the initiatives that are happening and how they can be tied together. So I'm going to kind of weave that web for you and then tie it into the work that we're doing at One Yukon Coalition. So throughout there's a couple of initiatives that I really have to highlight. And I'm going to just name off a bunch of them, and then I'll pull them all together. So we've got the Yukon First Nation Education Directorate. We've got the IISD, which is the Institute for Indigenous Self-Determination. We've got Putting People First. We've got the First Nation Information Governance Strategy, and YSPOR, and Yukon Strategy for Patient-Oriented Research. And there's another initiative that we're working on, which is the NEAR initiative. So NEAR is the Network for Indigenous Environmental Health Network. It's the Network for Indigenous Health Researchers. And then the work of One Yukon Coalition. So Just prior, so in March of 2020, that's when everything hit the fan here globally with the pandemic. And at the time, I was hunkering down out in Burwash, and I got a call from Minister Frost and Chief Bill and said, Medea, we want you to be the coordinator we want you to be the person that works as a coordinator for Yukon First Nations on this thing called COVID. So it should be done by the end of the month. We'll give you a 2-week contract. And I was like, I don't know if 2 weeks is going to be enough. So 2 weeks turned into almost 3 years. And a lot of lessons learned in that. I think the biggest lesson, and we did a research project out of the pandemic, and it's called, help me out. Oh yeah, yes, it's in the agenda. Thank you. It's got a long academic title. Interjurisdictional dynamics of intergovernmental relations and blah, 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 blah. Really what it is looking at that landscape of what is the dynamics between First Nation governments, territorial government, federal government, and how do they work together, and how can they better work together, bottom line. So that project really was pulling all those lessons learned that we saw out of the pandemic. The big lessons for me were working together and having dialogue and having communications, game changer. Being able to talk to people at the expert level, so having Dr. Hanley on a call with all the chiefs and be able to have him talk about case counts and variants and talk about what kind of measures need to be put into a community, and having minister there to talk about what kind of supports could be given to the community, or how could the community and the territorial government work together to keep people safe. And then when the vaccines came out, like how does that roll out? This idea of working together hand in hand was incredible. And it actually set us aside, or set us apart from a lot of other jurisdictions in the country. We were able to make decisions a lot faster and make decisions. We broke down a lot of silos, a lot of barriers, because there was a lot of working groups that ended up forming across silos, across jurisdictions, across departments. And that in itself is a huge benefit to program delivery. And there was a lot of, coming out of that, it was also this piece of communities know how to take care of themselves. Yukon First Nations, through our assistance with the National Microbiology Lab, we were able to distribute rapid tests before the territorial government did to the general population. We had that in the hands of every community that was having an outbreak. We got the tests in boxes. I remember it was like the first week of October, and I met with the chief, newly elected chief of Carcross. They were having an outbreak, and at that time, testing was taking anywhere from 6 to 10 days, average about 8 days to get results. So people were having to isolate. If they got a test, a PCR test. Not only that, the PCR tests are so invasive. So the testing time was a deterrent for people to go get tested because they couldn't isolate. If you're taking care of children, you're taking care of your elderly parents, you're the sole breadwinner in a household, you can't afford to take 10 days to wait for a test result and then isolate for 14 days. Like, it's not practical. And the administration of distribution of self-tests was incredible. And there was a lot of pushback from the powers that be to First Nations administering or distributing rapid tests. People wouldn't know how to stick a swab up their nose. I'm like, are you kidding me? We did a video. There, they know how to do it. We did lessons. So there was a lot. The chiefs were in full support of making this happen. And that in itself really speaks to the authority of chiefs. So when you think of the jurisdiction, and we heard it yesterday, we heard it today, health is under the jurisdiction of YG. It doesn't mean we have to wait for YG to give us good health. We can take care of ourselves. And I think that was one of the biggest lessons for me through the pandemic. How do we empower communities to take care of themselves? How do we give them the tools to take care of themselves? And throughout all of these initiatives, so one of the first contracts, and this was a contract that had started with Karen Barnes, when Karen Barnes was still the president of Yukon College at the time, transitioning to Yukon University, was the reimagining or the affirmation of the Institute for Indigenous Self-Determination. So I'm just going to talk about that project a little bit because it's a really important piece, and I have to give kudos to Tosh, whose eyebrow might twitch with the IISD, but back in 2016, Ranj Pillay was not the premier. He was working as a contractor for Yukon U, and he had gone to all the communities and talked about what's required from your community. How can Yukon College work to help you implement your agreements? Is there a partnership needed? Is there a formal structure needed to make this university flourish, to make your government and your self-government agreements really come to life, bring life to them? So, of course, and I was chief at the time, so I was like, hell yeah, we do need that. We need to have a partnership with Yukon U, and we need to have these types of training. So out of that, there was a lot of, from 2016 to when I took on the contract in 2019, a lot of discussion about what the IISD could look like. So principles were it needed to be in support of the final agreements. So what kind of capacity is required from communities? And at the end of the 2019 initiatives, it was an affirmation from all of the leadership at that time and Yukon U that the two pillars were capacity development and research. So having the opportunity to go to all the communities and talk with the communities and the leadership about what kind of initiatives or what kind of capacity development do you see you need? And resounding, the First Nations prior to the pandemic were talking about the need to have policy writers. Like, we need people who can do and create policy and who know how to navigate and create legislation. We need accountants. We need people in our finance department. We need to have people who can take on and sit at a negotiating table and talk about the renegotiation of health transfers or of program transfers. So there was a lot of discussion around what do we need in our communities to really support the implementation of our agreements. Lands officers was another one. So we need lands technicians. We need people who can really understand and articulate and train on what the agreements are. And then the flip side of that conversation was research. We need to have research done in our community around these types of programs. Is this an effective program? Is it something that we should be continuing and putting more initiatives into? First Nation governments are really good at starting up new programs and putting money into them and getting them going, but are we evaluating them properly? Are we able to say, do that evidence-based decision-making, saying this has changed the lives of these people, this has improved the economic outcomes in our community. There's so many research opportunities. And I'm going to use an example from Kluane First Nation. One of the things that we ended up doing was there was so much research happening. We have the Arctic Institute at the end of Kluane Lake, or the Kluane Lake Research Center station, and there's always a lot of research happening in all of our Indigenous communities. And I have to thank Pauline for saying nothing about us without us, because a lot of that research was happening in our community, and we did not have a say, or we didn't know what the research was being done. We didn't know what the outcomes of the research were. There was no report back to the community. People were being interviewed, signing off on these interview forms and given a $10 gift card. And then it's like, okay, so what happened? And in the best circumstances, you're given your interview back to edit and to affirm this is what you had said. But do you see it in the big picture of the final report? Or is it shared in a way that could be heard? I'm not going to expect my 94-year-old grandma who participated in a research project to read a 64-page research document. No, that's not making research accessible. So we had a research summit, and we talked about our research priorities as a council, as a nation. What kinds of things, what kind of research do we want done in our community? And we were able to fully articulate what our priorities were. And really, at that time, there was road washouts. We in Burwash, we have a really unique geographical region because we're on the Denali Fault Line, we're adjacent to a national park, we're on the shores of the largest lake in the Yukon. And Peter Johnson always argues with me that Teslin Lake would be bigger if it didn't go into BC, but it does, so it's not. And then we have our really strong dependence on the lake as a lifeline for our food, for transport, for just a well-being. And then we have all of the mineral development that is in our traditional territory on some of our settlement lands. So we set our research priorities as we wanted to know the health of the lake. So we took bathymetrics is one of our priority areas. We wanted to know if the fish in the lake was healthy to eat. Do we have a large mercury contamination or not? Are we putting ourselves at risk by relying on lake trout and whitefish as our food source during the winter? And so we found somebody, and I have to give kudos to David Hick, who was working as the director of the Kluane Lake Research Station at the time, and he was amazing and found PhDs who could come into the community and do that work with us. And we were able to meet with them before the work was conducted, talked about methodologies, we talked about reporting back and how we wanted our community to be involved. So in all of those projects, and then the other big one that we ended up conducting was flying VTEM over some of the mineralization deposits in our lands. So that was a project that we did with NRCan. But it's those types of like sitting down, what are your priorities in the community? That is what research and that pillar of research under the IISD could be doing and helping nations fulfill, because we all are faced with our own unique challenges in all of the territory, not just like, I think of the territory more than just Whitehorse. Having that First Nation perspective, know that the situation in Mayo is very different than the situation in Burwash, or the situation in Ross River, or Beaver Creek, or Old Crow is very different, and there's a different skill set at every community. Old Crow has been doing research and participating in land-based research, environmental research for many years, and they have protocols that they expect you to go through. They have community involvement. And it's those types of initiatives that we need to bring that level of sophistication to all of our communities. And how do we get there? How do we level that playing field? Because yesterday we were talking about equity in health. And it's really, how do we address that inequity? How do we build that capacity in all of our communities so that we do have research initiatives, we do have capacity development to meet the needs of our unique needs of our communities? One of the big things, the kind of crux of that capacity development under the IISD is the idea of place-based learning. One of the biggest challenges that we heard from all of the communities was the fact that we send kids, our youth, to go, our members to go to school in Whitehorse, and they can't afford the rent, they don't have daycare, they just don't have the supports that are required to make them successful in their education pursuits. So we need to have place-based learning so that they can have the support here in the community. They're not leaving the daycare that's here. They're not leaving their aunties and uncles who take the kids when they have to do homework at night. Can you imagine? I'm only on my second cup of coffee, and could you imagine me after? So that place-based learning and the mentorship capacity piece around the IISD is what will make it a success and also set it apart. It's what the communities need. It's what they're asking for. And so this is kind of a call out. If you know people in your community, if you have a hub, a university hub in your community, and you know that there are people in your community that have a spark, they just need some nurturing, could they be a mentee? Do you have mentors in your community that could participate in something like this? So these are conversations that are ongoing and that really need community to be part of. And one of the things that we haven't done is gone back to the nations and talked to each community, each leadership about where they're at post-pandemic. Is it mental health? Is it community well-being? Is it, we've got like a midwifery association that's still in its infancy here. Is there a need to bring midwives back? Is there a need to bring community liaisons back? And I think there's that discussion that still needs to happen about what capacity development looks like in the communities. So that's the IISD. This ties, I think of the IISD as being very complementary to what Melanie is doing at the Yukon First Nation Education Directorate. And most of you know of the Education Directorate, right? Yes, I see lots of nodding heads. The Education Directorate is really looking at K4 to 12. How are we changing the trajectory of our youth that are not being successful out of school? One of the biggest challenges in all those discussions was we have a lot of our youth that are graduating, but they're graduating and they still require 2 years of upgrading. And to me, that's a failure of the system. And it's not just to me. I'm sure lots of parents are a little peeved about that being the outcome of our education system, especially for Indigenous youth. And that's not fair. So how do we change that? And the programming that is being put in place through the YFNED is changing that trajectory. Kids are getting healthy meals at school. They're getting cultural supports. They're getting academic supports. They're getting the supports that they need, and it's customized. It is, obviously, it's ruffling feathers, but you know what? Change doesn't happen without ruffling a few feathers. So I think, to me, that's an indication that we're on the right path because there is some disruption. I was just in Hawaii and had a week vacation, yay, which I haven't had a vacation in a long time. Just like a downtime vacation. And I was just thinking of change doesn't happen unless there's shift, right? So as I said yesterday, shift happens. But I was just thinking of the tides. Like when the tides come, it creates dramatic change in the tidal pools, and there is disruption. There's disruption to all of that kind of area in that tidal zone, and it's beautiful, but because it brings out the resiliency of all of the species that are within that tidal zone. And I just think of that, like how could this disruption, what we're going through in the Yukon, really provide an opportunity to thrive, to show the resiliency that we have in the territory. So the YFNAD and the IISD are kind of complementary. There is an opportunity to really do that place-based learning. If kids or youth are not successful in the school system, how do we create place-based learning in our communities to catch those individuals so they know that they're nurtured and that they're cared for and that they're not going to get bored and turn to drugs and alcohol? And that's a reality in our communities. So out of all of that work is this other project, and it's the First Nation Data Governance Strategy. So the First Nation Data Governance Strategy is a national strategy. CYFN is the lead proponent for the territory on that data governance strategy. When you think of all the things that Pauline was mentioning and that we talked about yesterday, and these initiatives around education, this is all creating data. And you have to make these evidence-based decisions, so it is tying in data. The question is, and I don't know, some of you may recall back in, I think it was like 2015, 2016, Pauline was the head of the Self-Government Secretariat, and we had a project, and it was around, it was a data governance strategy piece. That project didn't, like it started, it incubated, Pauline left, the Self-Government Secretariat kind of fell apart. And now we're back to this national initiative that is looking at how does First Nations want to look at and manage data in their communities. And there's I'm gonna encourage you to go to the FNIDG's website. It's a national website. They have a bunch of training initiatives on there. The training for OCAP is on that website. So the principles of ownership, control, access, and possession. That training initiative is an initiative of the First Nation Data Governance Center. And they also look after a couple of other initiatives that happen here. So the regional health surveys, the economic and labor surveys. There's a few surveys that are generated by and for First Nations. So when you participate in surveys, all those annoying calls that you get or the repeat emails and letters that get sent to your inbox, those are from usually territorial government or federal government. We don't have access. First Nation governments do not have access to that information. We get results from StatsCan much later, and then it's not timely enough, so you're not able to translate that information into action. You can't take old information, especially when you're faced with health crises and pandemics and anything like that. You need timely access to data. That is just damn it. And that's where this FNIDG, First Nation Data Governance Strategy, really comes into play. So right now there's I see Shireen. Wait, put your hand up. So Shireen is working on that data governance consultation and needs to have input from communities about what data governance in your community looks like. And for me, thinking big picture from being in that governance position at a nation, we need and I have to put it in kind of two categories. So you have the HIPAA compliant information, which is identifiable health data, or anything that has your name, your date of birth, and social insurance number. Those are all protected information. And then there's information that you need to do the work in your nation. So I'm thinking of things like, from a government perspective, land management, wildlife management, water quality, water monitoring, education stats. When we go to the table and we negotiate our FTA renewals, we need to know how much program dollars were spent. Did it meet the mark? Did we have to reallocate dollars from one initiative to another in order to meet the needs of that initiative? And how many people did we serve? What was the economic outcomes of that? So it's not just collecting the data, but it's also analyzing and interpreting that to tell a story. So for us, it is around all of these data initiatives. So when you think of wildlife numbers, we've got low sheep numbers, we've got low moose numbers. How are we translating that information into action? We can go to the government and advocate for the closure of sheep hunting in our territory, which we have. And we're also advocating for closures of moose hunting zones. And you can imagine the pushback on things like that, but you have the data to back it up. So it's things in your nation. It could be birth rates, like are the babies being born healthy? What's your diabetes rate? How are you providing programs and services to those individuals who have healthcare needs that might not be readily accessible in your community? So there's a when you think of data governance, it's broad, it's huge. So I don't envy the task that Shireen has, because it is huge when you have to go to all the territories and come up with a plan for expected outcomes around data management. And this also means that there needs to be a data relationship between First Nations and the territorial government. So all of this it's massive, and one of the biggest pieces that we need to be talking about in our communities is, Pauline had mentioned it, is One Health. So my husband's from New Zealand, so we travel to New Zealand quite often, and I had the opportunity of receiving health care in New Zealand, and my children as well. So when you go to New Zealand and you go to a clinic there, the doctor, the clinician is putting your information into the system immediately. I can go to that clinic and then go to another clinic down the road in another city, another town, and the information will immediately pop up as soon as they put in my name and my number. That is incredible. Can you imagine the continuity? So the first time I experienced that was back in 99, like 99. It was 24 years ago. And New Zealand's population it's not that big. It was 5 million people. But that continuity of care, no matter where you are in the country, you can know that the person who's going to pull up your name and number will absolutely have your health history and be able to provide a good continuum of care. It seemed like such a no-brainer. So when you imagine our healthcare system here, and yes, we're doing the best we can with what we got, but we can always do better, right? And this piece about One Health and the continuum of care, how are First Nations going to be able to access some of that information to provide care in our communities? That is a discussion that needs to be happening at a government level. And the governments, your leadership in your First Nation, in your communities, need to have the input from the ground about what that looks like. What kind of information do you need access to? What kind of information do you need to make your programs better? What kind of real-time data do you actually need to implement something in your community that is going to change the lives or save the lives of people in your community? And I think that's the big tie-in. So we've all been talking about data, But there's some real questions on the ground that need to be answered. How are First Nation governments, as another level of government here in the territory, going to be able to access this type of information that is going to affect their citizens, regardless of whether they're in their territory? A lot of citizens live here in Whitehorse. And how does my nation provide care or provide assistance for care to me while I'm living here? It can't be this old Indian Act mentality of, oh, you're off reserve, so you don't get to get services. And I think there's a really big opportunity for grassroots discussion on data. So we talked yesterday, and you guys all know what the Y-Spore background is. One of the big things is around this patient-oriented research. How is it supporting this research? And it also has hubs. I mentioned yesterday about the NEAR and how the NEAR can actually build up or incubate and be kind of complementary. If we're looking at Indigenous health research, we will need access to that One Health data. We will need access to game-changing information in order to provide programs and services. And through the NEAR Research Hub, that could be a possibility. So when we look at all of those initiatives, the data governance, Y-Spore, the NEAR, and putting people first, like putting people first is a massive shift when we talk about the healthcare the way it is right now and the healthcare where it could be through this new health authority and having a seat at the table, having a say in decision making. That is the biggest opportunity that our communities have ever seen, ever, outside of final agreements being signed. So 50 years of negotiations and 30 years of implementation of our agreements, we're finally at a stage where we get to say, we want to see it at that table and have some sort of governance over health provision for our communities. And we need to be able to back that up. So we need community champions in order to do that. Out of all of those initiatives, one of the biggest things, so in March of this year, CYFN said, we're not going to do COVID, we're out of the COVID game. So there's still, COVID's still here. I'm sure all of you guys have friends and family that have contracted COVID lately. Hopefully you're getting your new booster. I'm going to do a little plug for vaccines, very important. The latest vaccine is available, and you can get it with your flu shot as well. One of the biggest things that we saw out of the pandemic was this need for building that capacity in community. So we formulated One Yukon Coalition, and I'm just going to read the mandate or the outcome or our statement for what One Yukon Coalition is. It's a nonprofit organization forged from a holistic, partnership-driven approach to advancing community health and wellness priorities in the Yukon. One Yukon collaborates with communities, municipalities, and all levels of government to foster awareness and readiness for both current and future public health emergencies, and to deliver programs and services that support community health and wellness priorities. For 2023, our primary objective of One Yukon Coalition involves expanding the existing wastewater monitoring network, developed in partnership with participating Yukon First Nations, municipalities, and the Public Health Agency of Canada and the Government of Yukon. So out of the pandemic, we had really looked at what's a less invasive way to get data, and it was wastewater, which is so shitty. We have all kinds of poop jokes. It is an incredible resource for data, and it gives you an incredible span of what the health of a community is. So you can test for all kinds of things. What we test for right now and have been testing for about a year and a bit is in Haines Junction and here in Whitehorse at the Whistle Bend facility, test for COVID, flu, and RSV, and are able to take that information, and Champagne-Ajax translated that into community advisories and implement policies where, no, we've got an outbreak right now, or we see a spike in cases. If you're coming into the office, please wear a mask. Like, just kind of simple, life-saving policy changes, but they're able to do it in a timely manner because they're seeing that information. So the wastewater program has, it's expanding. Right now, it's expanding to Watson Lake and Dawson. We've got Mayo on the list, Carmax, and Teslin is an potential site. So all of those sites together will give us a bird's eye view of what the health of the territory is. So when you think of the border getting crossed or closed off when people were coming in during the pandemic, that we saw a lot of the COVID come in on the highway or at the airports, and this will give us a good picture of how transmissible viruses, bacteria, whatever, are traveling through our territory. So we'll have a way of monitoring along the Alaska Highway and then up into the Klondike and into the heart of the Yukon and Mayo. So wastewater initiatives allows us to build mini labs. So we have worked with the Public Health Agency of Canada to get the Gene Expert devices. The Gene Expert devices are a PCR quality device that you get trained through the National Microbiology Lab, and you're able to take that sample and run it through a centrifuge and put it into the cartridges and run a test and know what the health of your community is. So we're using it specifically for wastewater right now. The Gene Expert is the same device that's used at the hospital for PCR testing right now. It also has the capability, it's an amazing machine. It has the capability of testing for cancers, for TB, for HIV, syphilis. There's a whole breadth of tests that can be run out of the Gene Expert device, and it's about the size of a printer. Training technicians in our community, bringing that capacity to the community is a game changer. Can you imagine the nurses that are overtaxed in the communities right now, they run a sample, having a technician that can run the equipment off hours, that just takes a load off of community nursing. And that actually builds community health in the fact that our technicians will be members of the community and they're looking out for the best interest of our communities. So the other thing that we're working on is things like getting this HIV self-test kit out. So this is results in, I think, 1 minute, results in 1 minute. And we're working with YG on how to integrate these self-tests to care. Because once you do a test, and if you're positive, who do you go to for help? There's a national network that we work with, but we want to make sure that we're doing these types of things in a way that's supported by community, for community, and also integrated with the health system as it is right now. The other thing that I got told to work on yesterday, yeah, I got 1 minute, is things like this. So it's that handbook, the handbook around opioids and helping parents deal with that. That's the kind of stuff that COVID or that the One Yukon Coalition wants to work on. Because COVID is something that really pointed out the flaws in our system, and it also exacerbated a lot of other kind of weaknesses in our fabric or in our society. And we have things like a syphilis outbreak, things like the toxic drug supply killing off a lot of our youth. How are we fighting that? And syphilis is just the one of the other things that we're working on. So we've got a small team, and small but mighty, and we're looking to expand that. So call out if you want to do some work with One Yukon Coalition in any field, in research, in developing community capacity, in coming up with community initiatives. You want to work on a book? Yay! Want to be the community that runs pilot projects? Yes, so there's a bunch of initiatives there. I do want to, because now my time's up, and I have to do a draw.
Well, but we want to give folks, because you, in typical Mythia fashion, dropped a whole bunch of information on folks. And so I just want to give chance for anybody who's got questions about One Yukon or some of the other information that you've shared. I've got hands up. So we've got about 5 minutes for questions, and then we'll jump to the ATV presentation, which is not about four-wheelers, people. Okay? In 2 seconds. I'm not as fast as Davida. Oh, what a beautiful jacket, too. Just want to, I bet people touch it all the time.
Okay, yeah, it's dirty, too. Mattia, I want to applaud you for all your work and for the initiative you're undertaking. I believe that we all need to return to practicing well-being and figuring out what that looks like. And I think creating pictures over time of well-being is hugely important in that work. And the integration of dialogue and data and research will make that happen. So I would be so pleased if I can be part of this work because it's essential. Thanks.
Yay. I'm like, recruitment at, at forums works. Yay. Thank you.
Any other questions or
Come on, you guys. You must have questions. Comments.
Online, Jesse, if anybody's got questions, just let us know.
Nobody?
Okay, you're going to sit with that information. You're going to wake up at 3 o'clock in the morning and go, damn it, I should have asked Mythia this. It's okay. You can find her on Facebook. She's the only Mythia in the territory, the North, probably Canada.